To perceive the band, turn the long knob to move the locking vise all the way down to the head of the retainer. Then turn the short knob to loosen the retaining screw. The retaining screw should disengage from the sliding body. Fold the band to form a loop. Notice that when the band is folded, one edge has a smaller circumference than the other. This design accommodates the difference in tooth circumferences at the contact and gingival levels. There are two main rules for correct placement of the matrix system on the tooth. 1. Open end of the retainer head is always placed toward the gingiva. 2. Smaller circumference of the band is always placed toward the gingiva. These rules serve as a guide to how the matrix band must be positioned in the retainer. With the rules in mind, place the two ends of the band in the slot of the locking vise, with the occlusal edge of the band facing the retainer, and position the band in the correct slot of the head, such that the rules above will be satisfied. Turn the small knob clockwise, lowering the screw into the vise and thus locking the matrix band within the retainer. To check that the matrix band is tightly adapted to the gingival surface, use an explorer and try as hard as possible to place the tip between the matrix band and the gingival cavosurface margin. You should not be able to do so. This also helps to remove any unsupported enamel left in the area. Place the wedge. Once it is seated tightly in the gingival embrasure, loosen the matrix band slightly by turning the knob 1/4 of a turn. This prevents the matrix band from being too tight, which may lead to an open contact and may hinder proper condensation of the amalgam into the proximal cavosurface margin areas. Finally, use a spoon excavator or burnisher to burnish the matrix band to the adjacent proximal contact area.